Hi, my name is Lindsay Beacham. I'm an FNP student, and my presentation is an analysis of depression screening rates within a local urgent care facility that utilizes the PHQ-2 questionnaire. Around 300 million people are affected by depression worldwide, making it a major contributor to the overall burden of disease. 1 in 15 adults will be affected by depression in a given year. The economic burden of this disease is significant for the patient as well as society. Depression is often a comorbidity of other chronic diseases managed in primary care and can impair the patient's compliance and the provider's ability to manage their disease, which makes depression screening and treatment even more essential. Of all the mental health conditions, depression is one of the most treatable, but unfortunately often goes undiagnosed. The USPSTF recommends screening of all adults aged 18 or older, regardless of risk factors. And a comparison study showed a national screening rate of 4.2%. The objective of this study was to compare the rates of depression screening in a local urgent care facility in Arkansas to the national average of 4.2%. The study was conducted using a retrospective chart review. Charts were reviewed in an urgent care facility in Hensley, Arkansas. Data was gathered from 50 charts between January 2020 to April 2020. And the depression screen was considered complete if the PHQ-2 was documented on the patient chart in the past 12 months. The inclusion criteria was male or female, age 18 or older, and a new or established patient visit. Exclusion criteria was male or female less than 18 years of age, or an active diagnosis of depression. 54% of the population was female, and 46% was male. 12% were African Americans, and 88% were Caucasian. The age range for the population was 18 to 81 years old. The findings show of the 50 charts reviewed that 84% of the sample population was screened for depression using the PHQ-2 in the last 12 months. The results show this facility has a much higher depression screening rate than the national average. However, 16% of the sample population still went without proper screening. Limitations of the study were a small sample size with only 50 charts. The facility analyzed was primarily a walk-in clinic for acute care. The data was collected from only one clinic with 2 providers and minimal cultural diversity. Conclusion: the screening rate at this facility is much higher than the comparison study. However, they are not fully compliant with the guidelines set forth by the USPSTF, which recommend all adults be screened for depression. Implications from the study reveal need for further education on importance of depression screening and compliance with the USPSTF guidelines. It includes they should try to include the PHQ-2 as part of patient intake and establish a way to flag charts in the EMR when there is no screening documented for the past 12 months. And for patients who screen positive, ensure they are diagnosed properly, evidence-based treatment is given, referrals are initiated as needed, and follow-up care is always provided. To conclude, the facility should work towards having an even higher depression screening rate to increase their chances of diagnosing patients and therefore increase the chances for treatment. According to research, 70% of people will improve with proper treatment, making performing screenings that are compliant with guidelines so important. Thank you for your time, and I would also like to thank my faculty mentor, Ms. Hadley, for her guidance during this research project.